Second part of the information center is known as the sources of drug information. So there are different type of sources. They are known as the primary sources, secondary sources, and tertiary sources. So drug information can be obtained from journals, research papers, books, pharmaceutical sales, and representatives. They are given as the information of different subjects or topics that is required by the different dignitaries of medical staff. So drug information sources can be classified into three categories: primary sources, secondary sources, and tertiary sources. So benefit of these sources is given one by one. That is primary sources. Primary sources are original information on which other research is based. So that include the primary source is the base of every sources, that is known as the primary. So first is known as the patents. Patents are newly discovered drugs are reported in patents. Patent means individual work is produced or discovered or research, and it is given information to the government data, that is government of India or United States. So they will give the permission of known as the patent, means this type of the drug can be produced only by this uh, particular person, not by the all. So that is known as the patents, and that cannot be copied by the other organization, institutions, or other peoples. Then second, research journals or periodicals. The scientific research is published here, that is available into the library. Different types of research journal like PubMed is there, Science Direct is there. So they are using the publishing the different types of research papers, but these are the very powerful or very important type of research journals. So that's why they require the particular set of standard is there. So which standard can be mentioned? So if new drug is there or new phytopharmaceutical or new drug is was there, can be produced by the scientists. So they must give the data of nuclear magnetic resonance and mass spectroscopy. So this type of data only can be accepted. Below that standard they are not going to accept the research paper, or they are not going to accept the particular drug information. So this is the standard quality of this particular research journal and periodicals. Then third is known as the reports. Reports are the research done individually or at organization, which may be published in journals or is available at organization after paying. Means so many reports, that is research reports are into the journals. The journals may be free, so we can easily access by the internet, or any other journals which have to make the subscription, only then we can watch or we can observe or read that or take the print of that particular research journal. So there are the three parts into the primary sources known as patents, research journals or periodicals, and reports. Primary sources other is known as the conferences. Conferences which is organized by the government or private sectors, and these conferences like Pharmacy Council of India, they can be make the conferences, or university level or college level they can arrange the conferences, and into that conferences research papers are published, or research paper they can be shown to the students. So research presented at conference, these papers may be published into the books. So may be published, not compulsory, they may be published in the books or in special issues of journals, or may not be published. Sometimes they cannot be published. So this is the type of known as conference. So conference papers can be published or not be published. Then dissertations. Dissertation means M.Pharm and PhD thesis. They are known as the dissertations. These include the detailed research work done on the completion of higher studies, like these submitted for completion of Master of Pharmacy or philosophy in pharmaceutical sciences. So this type of the given in terms of your dissertation. So it is also required the particular topic or particular subject or particular drug, they can be studied thoroughly in terms of the dissertation of PG or PhD. Then primary sources, different types are given, like advantages and disadvantages. Advantages are there, they are the current information on drugs are very easily available because the research done into the primary source only onto the new molecules or latest updates. So that's why very easily available this type of the information. Then provide the information on new drugs. Always they are in given the new drugs information, and this new can be given in terms of primary sources. So it is very easily available and only to the new drugs. And then is the disadvantages. Limited data is available. Limited data means vast type of information is generally not available to the primary sources, but primary sources is important. Information on drug may be controversial. Controversial means some maybe say that scientists say that this information or to the may not give the this type of activities or not. So may other scientists say that this is the important in terms of this activity. So this data may be sometimes controversial because this is only the crude type of material. So that's why extensive work has to be done onto the raw material or onto the primary sources. So that's why this data may be sometimes controversial. Then secondary sources. So secondary sources can be taken out from the your primary sources. Secondary sources collect the information from primary sources. These sources analyze, they will be secondary sources will analyze the information taken from the primary sources. Evaluated means it is true or false, we can evaluate it. Then interpret means how they can be used, how can they what is the amount of use or what is the category of use, what they known as the interpret. It may be used in this a drug or various types of activities or screening of activities of drugs or diseases, that is known as the interpretation. Then repackage means you have to package it in different doses forms. Then summarize means all type of information should be gathered, that is summarized. And reorganize the information reported in primary sources. Reorganize means all type of information regarding the particular drug or particular information should be gathered from the various primary sources, from books, dissertations, compendium, and then uh, conferences. This is known as the reorganize the information reported in the primary sources. Then secondary sources include the books or article. So secondary may be different types of books like pharmacology book, pharmacology book, pharmaceutical sciences books. So this type of books are include as known as the secondary sources. Then these sources are also include textbook. Different types of books are there, subject books. So textbooks contain small information of drugs like pharmacology books. Small content means only useful, that is pharmacokinetic, pharmacodynamic, its adverse effect, its side effects, its whole activity use is there. So that information generally we can say it is large information, but in terms of research level this information is very small information is there. Review articles, these are the prepared from the primary sources and focused on the specific type. So specific type of information only is taken from the review article. Review article means only drug, single drug or any disease is taken, and onto that various information available into the primary sources and various information available in the internet sources, they can be gathered or collected, that is known as the review articles. Means how many scientists are working on the particular drug or particular disease. For example, 150 or 200 types of scientists working on only onto the one drug, so that all information has been gathered into the one roof, that is known as a review article. Then databases. Databases mean include the online sources like Embase, PubMed, Springer, and Medline or Science Directs. So these are the types of journals are there. So this journal may be sometimes free or sometimes paid. Paid means you have to take the annual subscription, 6 monthly subscription or bi-monthly subscription, so that you can save, print or collect the data. We can view or review or read the data, otherwise you cannot go through the particular data. So that is the database. This is a type of international level of journals. So this is also important, very important sources of references, that is Embase, PubMed, Springer, Medline and Science Directs. Then tertiary sources. Tertiary sources are the taken from the primary and secondary sources, but tertiary sources contain a very large or vast type of information of particular topic or subject. Tertiary sources prepared from the primary and secondary sources. It will provide a summary of the primary and secondary research. Means primary and secondary research, how much research has been collected or taken, so that is given from the your going to the tertiary sources. Tertiary sources include textbooks, sometimes considered as secondary ones. That already we can know that textbooks are considered as a secondary sources. Contain the information, very concise information, very important information, but very less information is there. Then dictionaries also have the information is there. Then encyclopedias, we can go through the Indian Pharmacopoeia, that is IP, National Pharmacology from the European, and your US Pharmacopoeia. So this type of books we can take as second tertiary sources. So this content very important, but these books are very costly, so that's why they are also available in the institution, and they can view, we can review, or we can read that particular IP and USP or British Pharmacopoeia. Then guidebooks, different types of books are known as the guidebooks that contain the very short information. Then directories, different types of directories are there, like Merck index we can use for the information of the drugs. Almanacs means annual subscription or annual presentation of the different topics, that is almanacs. Fact books known as activities are there. Known Wikipedia is given as the information all over the world into that particular Wikipedia of the particular subject or topic, that is given by the tertiary sources. Then compendium is a part of the different books. Large books are there, extra copies are be added, they are the compendium or appendix, so they can be used as the tertiary sources. Then indexing and abstract sources. Indexing means different type of books or journals are where they can be indexed, means short only given the name of the scientist or drug, we can take the information from that, indexing different categories. So this type of indexing is there. We can refer the books or refer the online research, they are the index. And abstracting sources. Abstracting sources means what are the sources, primary sources, secondary sources or tertiary sources, they can take the abstract from that, so they are known as the primary tertiary sources. So this is the one of important part of the sourcing of information. They are known as the dictionaries, encyclopedias, manuals, guidebooks, directories, almanacs, fact books, Wikipedia, compendium, indexing and abstract sources. This is the type of activities are there we can use for the tertiary sources of information. So the tertiary source of information, very large type of information is there. So that is very important factor for the drug information sector and poison information sector. So that is the second part of the information center.